Knee pain is a very common injury in cheerleading, and most of you don't report it. A common thing that we see in the clinic is patella tendinitis. This is when you have pain in the front of the knee. This can be treatable with physical therapy. You just have to do some exercises to help get it to feel better. Here are some common exercises that you might do in physical therapy. One common reason that you may have patella tendinitis is the front of your leg, your quads, might be overworking compared to your glutes. So you can start with a quad stretch using the bretzel. Have your top leg in front, and you're gonna reach back and grab your foot and rotate back. This will stretch out the front of the thigh and get you some trunk rotation at the same time. Hold that for about 30 seconds. Go right into a single leg bridge. Lift your toes up, pull the other knee to your chest, and then lift your bottom. Do 5 to 10 reps. Stop if you start to feel it in your quads. Another common cause of pain in the front of the knee can be if the outside of your leg, your IT band, is overworked and too tight. So we can stretch this by bringing both knees over to the side, straightening the top leg. This is going to stretch the outside of the leg and get that stretch into the outside of the knee. Circle your foot to change the angle of the lower leg and get different fibers of the IT band to stretch. That can commonly happen because you may have some weakness in the front of the thigh. So follow that with a straight leg raise to activate that front of the thigh. Conversely, it could be because you have some weakness in the outer part of the hip. And to strengthen this, we're going to go on to one knee. Make sure that your knee sets up directly underneath your hip and that your hips are level. And you're just going to balance here to work that stabilization on the outer part of the hip. Yes, it might be tender in the front of the knee, but that's okay as long as it's tolerable for you. If it's too much, then don't do this one yet. The third reason you might have some overworked quads is if your calf muscle is too tight and it's creating limitation in your ankle mobility, which doesn't allow you to fully use your knee. So you can start by stretching the calf by standing on a step with your right foot, let your left heel drop down. This should feel like a nice stretch in the back of the calf. Again, you can hold this for 30 seconds, or you could go up and down to actively loosen it. You're going to follow that with some step-ups to work the front of the thigh and the glutes at the same time, just to get everything balanced. Make it a step that is high enough to give you some work, but doesn't create knee pain. If you have to, step up with your non-painful leg and step down using your involved leg on the stair. That can help to reduce some of the pain and work those muscles without irritating the front of the knee. As you can see, we included some exercises to both loosen up muscles on one aspect and strengthen other muscles. This is very common. If you're loosening something up, you need to keep that balance and strengthen the opposite. If you're having pain and you need to compete and you need to get through it, use ice at the end of practice. Give yourself a good warm-up. Make sure you include all of these exercises to warm your body up. Take breaks. Repetitive strain is the biggest cause of a tendinitis. So you need to do a little bit but not push. Your work should all be done by now. Your main thing, you should know your routine and know your spots. You're not learning new skills. So if you have to, take a break and go full out at competition. When you're done, land it solid, go back, do some stretching and some easy work, and then take some time off to let things rest and retrain your body so that you are not overworking your quads and you're not underserving your glutes. You can do this. Go get Summit and then take care of your body so everything feels better.